In the previous video, we saw the muscles of the arm. In this video, we are going to look at the muscles of the forearm. In between the elbow and the wrist lies the forearm, which is also called antebrachium. The forearm contains lots of muscles, and there are two groups of muscles. Muscles present in front of the forearm that allow for the flexion of the wrist joint, called the flexor forearm muscles, and the muscles present behind the forearm that allow for the extension of the wrist, or the forearm extensor muscles. So we have the forearm flexor muscles that allow for the flexion of the wrist joint, and forearm extensor muscle present behind the forearm that allow for the extension of the wrist joint. Okay, in this video we are going to learn about the forearm flexor muscles. There are altogether 8 forearm flexor muscles. These 8 forearm flexor muscles, they are arranged in 3 different layers. They are superficial layer, intermediate layer, and deep layer. Again, so the flexor compartment or the forearm flexor muscles, there are altogether 8 of them. They are arranged in 3 different layers. They are the superficial layer, the intermediate layer, and then the deep layer. Out of these 8 muscles, 4 are present in superficial layer, 1 is present in intermediate layer, and the remaining 3 are present in deep layer. Another way to remember is, so there's your superficial layer with 4 flexor muscles, intermediate layer with 1 flexor muscle, 4 minus 1, 3, and the deep layer with 3 forearm flexor muscles. Now, out of 8 forearm flexor muscles, 5 of them originate from medial epicondyle of humerus. What I want you to do is that continuously flex your wrist, and with the help of your fingers palpate the medial epicondyle. As you continuously flex your wrist, you'll be able to palpate a pulsating contraction at medial epicondyle. Why I told you to do so is for you to understand that majority, that is 5 of the forearm flexor muscles, they originate at the medial epicondyle. Alright, now let's look at the various layers. First, we have the superficial layer with 4 forearm flexor muscles. How to remember them? Okay, simple. This is what you need to do. Take out your forearm, take out the palm of your other hand, take out your other hand, put the thumb on the medial epicondyle and the rest of the fingers of your hand like this. Each of these fingers, they represent the muscles, the forearm flexor muscles of your superficial layer. Now, repeat after me. Pass as you lift your index finger. Pass, fail, pass, fail. Alternatively, pass, fail, pass, fail. Now, what's this mnemonic for? The first letter of pass, P, represents a muscle that also starts with the letter P. The first letter of fail, F, represents a muscle that also starts with the letter F. Okay, so you have your pollex and medial epicondyle, the rest of your fingers like this, and pass, fail, pass, fail. Let's begin. So pass, P for pronator teres. The meaning of teres is rounded or a tubular. So the muscle is tubular. So teres. When pronator teres muscle contracts, it allows for the pronation of the forearm, so-called pronator teres. It originates at the medial epicondyle. That's why I told you to put your thumb there. All 4 of these muscles, they originate at medial epicondyle. That's why I told you to put your thumb there. And it wraps around the radius. So as it contracts, it pulls the radius down and the forearm pronates. So pronator teres. Pass, done. Fail. F for flexor carpi radialis. Flexor because it allows for the flexion of the wrist joint. Carpi because the muscle, it passes through the carpal bone and inserts at the base of the second metacarpal. So here's the first metacarpal, then there's your second metacarpal, it inserts at the base of the second metacarpal. All right. Now, flexor because it allows for the flexion, carpi because it passes through the carpal bone. It passes through the carpal bone of which side? The side of the radius bone. So flexor, carpi, radialis. All right. It helps in flexion of the wrist and it also helps in radial deviation. Flexion of the wrist and radial deviation. So two muscles done. Pass for pronator teres allows for pronation of forearm. Fail for flexor, carpi, radialis. Now again, pass. P for palmaris longus. See, it has a long tendon. The interesting fact about this muscle is that it does not insert into a bone. Instead, it inserts into a flat tendon present on your palm called palmar aponeurosis. That's why palmaris longus. Longus because it has a long tendon, palmaris because it inserts into the palmaris aponeurosis. If you want to observe the tendon, this is what you need to do. Join the tip of your pinky finger and the tip of your pollex together. When you do that, you may be able to, or you may not be able to visualize a tendon right here, this tendon. This tendon is the tendon of your palmaris longus. The reason it is visible is because the tendon of the rest of the forearm muscles, the flexor muscles, they pass through the carpal tunnel underneath the transverse ligament of the carpal tunnel. However, the tendon of palmaris longus, it passes from above the carpal tunnel. That is why it is visible. All right. Some of you may not have the muscle, and if you don't have it, it's completely normal. It doesn't bring any harm to you. Okay. So we are done with pass, pronator teres, fail, flexor carpi radialis, pass, palmaris longus, again, fail. This is flexor carpi, but on which side? The ulnar side. So ulnaris. It also originates at the medial epicondyle and it inserts at the base of the fifth metacarpal or the pisiform bone or the hook of the hamate bone. All these 5 superficial forearm flexor muscles, they originate at the medial epicondyle through a common tendon with different insertions. Now let's look at the muscle of the intermediate layer. So in the intermediate layer of the flexor compartment of the forearm, one muscle is there, that is flexor digitorum superficialis. Now there are altogether 2 flexor digitorum muscle, one in intermediate layer and the other in deep layer. In respect to deep layer, the one in intermediate layer is superficial, that is why superficialis. Flexor digitorum because when the muscle contracts, it allows for the flexion of the second, third, fourth and fifth, not the first, the second, third, fourth and fifth digits of the hand. So flexor digitorum superficialis. The muscle, it originates at the medial epicondyle as well as the radius. And when the muscle contracts, the flexion of the second, third, fourth and fifth digits take place. However, there's one thing you might have noticed. The flexion of the digits has not occurred at the region of the distal interphalangeal joint. Why? This is why. So the muscle, it originates at the medial epicondyle and the radius, and it inserts in the middle phalanx. So the muscle, it crosses the metacarpophalangeal joint and the proximal interphalangeal joint and inserts into the middle phalanx. But it does not cross the distal interphalangeal joint. Since it does not cross the distal interphalangeal joint, it does not cause the flexion of the distal interphalangeal joint. So when the muscle contracts, the flexion at metacarpophalangeal joint occurs and the flexion at proximal interphalangeal joint occurs. As a result, you get something like this, where flexion has occurred here and here, but not here. The flexion has occurred in metacarpophalangeal joint, proximal interphalangeal joint, but the flexion has not occurred in distal interphalangeal joint. Now let's look at the deep muscles. So there are altogether 3 deep muscles. These deep muscles are also called punching muscles because they help in the formation of fist and to bring your forearm in a initial stage of punching someone. So you punch someone like this. So how do these muscles bring your forearm in this condition? Let's see. Okay, so here's your forearm. There are 3 deep muscles. First is your flexor digitorum profundus. In flexor digitorum superficialis, the insertion were in the middle phalanx. That is why the proximal interphalangeal joint could not flex. However, the flexor digitorum profundus has its insertions in the proximal phalanx. That is, it crosses the proximal interphalangeal joint. As a result, when the flexor digitorum profundus contracts, it flexes the proximal interphalangeal joint as well, and you get something like this. Wait, but then the fist is not complete. We want our fist to look something like this, right? For that, the flexion of the pollex has to occur, and that is brought about by the flexor pollicis longus. Pollex, so pollicis, flexor, because it brings about the flexion. So flexor pollicis longus. But then you don't hit a person with a fist like this, do you? You hit them like this. For that, you have to pronate the forearm, and that is brought about by a quadrangular muscle present right here. Since it is quadrangular in structure and allow for the pronation of the forearm, so pronator quadratus. All right, so what are the 3 deep muscles? Number 1, flexor digitorum profundus. Number 2, flexor pollicis longus. Number 3, quadratus, pronator quadratus. And there you go. There are the 3 punching muscles of the deep layer of your flexor compartment of forearm. And those are all the muscles of flexor compartment of forearm that you need to know. See you.